Knowledgeable modifiable factors of ischemic stroke. We have hypertension, diabetes mellitus, and obesity, smoking and increased fibrinogen, coronary heart disease, atrial fibrillation, left ventricular hypertrophy, dyslipidemia, physical inactivity, and depression and stress. Hypertension is the most known modifiable risk factor of ischemic stroke. The relationship between BP and stroke is strong and consistent and increases with age. Second is diabetes mellitus and obesity. Diabetes mellitus is a glucose metabolism disorder and clear risk factor in patients with cerebrovascular disease. Histology analysis of tissue of the brain following tissue stroke shows endothelial proliferation and hyalinosis of small intraparenchymal vessels seen frequently with patients who has DM. Smoking and increased fibrinogen are related to each other. It leads to blood vessel reduction compliance and it increases platelet aggregation, increases hematocrit, and increased cholesterol level. Increased fibrinogen in the blood has been found with people who had stroke and deep vein thrombosis. Coronary heart disease double the risk of stroke. An example of this is atherosclerosis, which is a deposition of lipoproteins in the vessels, lipoproteins which carries cholesterol and triglycerides. Fifth one is atrial fibrillation. It has a strong independent risk factor of stroke and it caused by embolism of left atrial appendage thrombi. We also have the left ventricular hypertrophy, a risk factor of cardiovascular events, but the effect is ischemic stroke. It happens when a patient has uncontrolled hypertension as it can lead to organ damage and has been found that some people who had left ventricular hypertrophy had ischemic stroke. Also, physical inactivity like no exercise or workout. Walking is very important exercise, and depression and stress that can contribute to heart attack and can lead to stroke.